Health systems all over the world are currently responding to the COVID-19 outbreak. In the absence of licensed vaccines or therapeutics, infection prevention and control (IPC) is the mainstay preventive measure for healthcare workers and communities. The Ministry of Health of Uganda, in collaboration with the Infectious Disease Institute (IDI), have prepared this training material to provide an understanding of the principles of IPC during the processes of screening, triaging, and management of patients being investigated for COVID or with confirmed COVID-19 disease.
In this video, we are going to demonstrate how to set up a screening area for a health facility. For COVID-19 outbreak, triage is particularly important to separate patients likely to be infected with COVID-19. Effective screening can prevent transmission of COVID-19 to patients and healthcare workers. Screening means an area in which an individual is evaluated and screened using a standard case definition. Current case definitions always have to be provided by the Ministry of Health. If a case definition is met, the patient should immediately be given a mask and directed to a separate area, that is an isolation room. At least 2 meters distance should be kept between suspected patients and other patients. Have clear signs directing patients with respiratory symptoms to immediately report to the registration desk. All patients, visitors, and healthcare workers should be screened for COVID-19 at the first point of contact with the health system. Screening should be done using a case definition issued by the local authorities, that is the Ministry of Health. Individuals that do not meet the criteria for COVID-19 shall be sent into routine triage, where they can be assessed and given facility-based care as needed. Individuals that meet the screening criteria for COVID-19 should be isolated immediately using institutional patient isolation protocols for taking of diagnostic samples, initiation of supportive care, taking more history to establish a line list of people at risk. Infection control considerations for screening: do not make physical contact with the patient during the screening process. Keep spatial separation of more than 1 meter at all times. Wear appropriate PPE, that is to say medical masks. Gloves are not required for this task. Ensure you perform hand hygiene before and after taking off PPEs. Use infrared thermometers to screen individuals for fever. Rapidly identify individuals with respiratory symptoms, that is coughing, sneezing, difficulty in breathing, and separate them from the rest of the people waiting to be screened. Offer these people a medical mask. Screening staff should stay out of the screening area if they've developed symptoms and should be evaluated as well.